Thanks, Mr. Chair, ladies and gentlemen, good night, and thank you for coming to this session. I would like first to thank Yeshila and all the members for this invitation, and I would also like to congratulate the two speakers about speaking about this very promising experience concerning rehabilitation. Sorry for my heavy accent. I am mainly French and Arabic speaker, but I will try today to speak English. Yes, in my country, drugs and alcohol remain a matter of concern. Although it's illegal and forbidden by the religion, this alcohol and drugs are highly available. And Morocco has been aware about this problem, and we conduct since last decade several epidemiological surveys to try to have an idea about this problem, because we know if we want to fix a problem, we have to measure it. So there are many surveys conducted. This survey concerned many specific population. It concerns also the general population. And this survey has been conducted mainly by the Ministry of Health and some academics from the universities in Morocco. And it was supposed by international organization. And what we learned about this survey, we learned that drug and alcohol is a problem in my country, and it concerns mainly males. Males are more consuming drugs than female, and we noticed that drug users are more and more younger, and this problem, it concerns also youth. There is also an increase about drug use, especially concerning females. And now all kinds of drugs are available. The most used drugs are tobacco, alcohol, cannabis, and psychotropic drugs without medical prescription. And here we are more talking about benzodiazepine. But in the north part of Morocco, there is an increase about heroin and cocaine use. And this increase is maybe because these places is close to Europe, and we are estimating that there is more than 5,000 active injecting drug users in this region. They are mainly using heroin, and they are also sharing needles. There is some survey, rapid assessment survey conducted in this region, and they found that HIV and VHC is high among the injecting drug users, and in some region in this north part of Morocco, for example in Nador, they found that 37.8% of injecting drug users are HIV positive, and almost 89% are HCV positive. So regarding to this outcome, Morocco set up strategies and politics regarding drug use. This is since 2005, and there is a creation of 7 new addiction centers since this time, and also there is the integration of harm reduction policy and politics in the public health, including needle exchange syringe, which started in 2008, especially in the north part of Morocco, and the methadone maintenance treatment. It started in 2010, and still now we have 5 centers providing methadone substitution treatment, and we have almost 700 patients. Morocco also created the National Observatory on Drugs on Addiction, and we are now ready to publish the first reports concerning drug use and addiction in the country. We were also aware about the importance of training people, because we could create a very beautiful center. We could adopt very promising strategies on public health. But if we don't have the qualified human resource, it couldn't work. So we create a kind of medical medical training at 2 medical schools in Rabat and Casablanca. And we are now training more than 30 medical doctors and nurses on addiction. But even we are doing a lot of effort in this area, we still have some gaps, like we don't have rehabilitation centers, we don't have still now any evidence-based prevention program, and we still need more addiction center because 7 or 8 centers is not enough for 30 million population. Let me give you some data concerning one of the most important survey conducted in 2003-2005. It was a national survey, and this survey found that alcohol have been abused in 2% people, and the other substances used was mainly cannabis, and it was abused by 3% population. And they found that the lifetime use of drugs is around 5.1, which put Morocco in the same level than other countries in the world. Now, I will talk about the MEDSPAD, the Mediterranean School Survey on Alcohol and Other Drugs. This survey has started since 1999. It's a kind of ESPAD of the European School Survey on Alcohol and Other Drugs, and it has been created for the south part of Mediterranean area. It includes some Mediterranean countries like Morocco, Tunisia, Algeria, Egypt, Lebanon, and Jordania. After a lot of meetings and a lot of work, in Morocco, we do a first pilot study to validate the questionnaire and the methodology of the MEDSPAD. It concerns 400 students. Then it has been launched in Alger in 2005. After that, in Morocco in 2006, in 2 big cities, which are Rabat and Salé. Lebanon did this survey in 2009. And then we do the first countrywide survey in Morocco in 2009-2010. Tunisia do it also last year. And last year, we do the second national survey in 2013. And some countries are now ready to do this survey, like Jordan and Egypt. And all these surveys are supported by Pompidou Group of the Council of Europe. So MEDSPAD Morocco, I will more talk about the last MEDSPAD Morocco. And I will go through some important data because of time. I will not have time to give you all data, all this survey data. The MEDSPAD Morocco 2030 is a collaborative work between our hospital, Arazi University Hospital, and between the Ministry of Education. And it has been funded by, totally funded by Pompidou Group. And it's the third survey conducted after 2006, 2009, and it was conducted by a researcher from Arazi Hospital. The objective of MEDSPAD Morocco is to have an idea about the prevalences of drug use concerning youth. We seek for tobacco, cannabis, alcohol, psychotropics without medical prescription, cocaine, crack, and heroin. The purpose is also to have an idea about the age at the onset of drug use among Moroccan youth, and to understand position, attitude, and point of view of youth regarding drugs. We try from this survey to have an idea about some predictive variable that could be very important to set up prevention programs which will be evidence-based. And we have also the objective to compare our data with other countries, especially the countries from the North Africa or the Arabic countries. And we are now trying to conduct the third national survey. We are seeking to do it in 2015. And the purpose of conducting this third survey is to have an idea about the trend of drug use in my country. So MedSpad is a cross-sectional survey, and it concerns especially 15 and 17 years old. Why we are targeting this age? Because this age gives us an idea about what is going on now in our country, and it will also give us an idea about this kid in the future. So we did a representative sample size of the Moroccan students, and we take in consideration many parameters. We did a kind of grape samplings, and we include all academic region in Morocco. We include high school students because we are targeting 15 and 17 years old. So we take the 4 last grades at schools, and schools' grades are randomly selected. And also, we didn't inform schools about this survey. It's to avoid some bias. So schools were not informed about this survey. We did a kind of questionnaire, which it's similar than SPAD and then the other MedSpad survey, but it has been translated, adapted to the Moroccan culture, to the Moroccan dialect, and validated. It's written in Arabic, anonymous. It's a self-questionnaire, include 120 items, and we did it in medium time was 35 minutes. So this questionnaire include items concerning the socio-demographic information about youth, some prevalences. We took 3 prevalences, lifetime prevalences, last 12 months and last 30 days, about tobacco, cannabis, alcohol, psychotropic drugs, like benzodiazepine or sedative without medical prescription, cocaine, crack, and heroin. We seek also to know about how the quantity of this drug use, the age of first onset, and the perception of drug use for different substances, as well as the attitude, youth attitude against drug users. And we try to have an idea about youth knowledge concerning drugs. Survivors were 10 resident researchers from Al-Razi Hospital. They have been trained to do this kind of survey, and each resident has a focus point in the schools. It helps him more for logistic need, and they have some guidelines, like when they come to school, as the schools have not been informed about the survey, they present the written authorization from the Ministry of Education. They have a list of grades that they will be assessed. So they ask for this grade, and they must be alone in the classroom to avoid the face-to-face bias. So the functionary of the Ministry of Education has not been allowed to be at schools, and they've emphasized the scientific purpose of responding with sincerely and to respond to that we respect the confidentiality of of the youth responses, and each researcher has a kind of survey evaluation. He put everything happened during the survey, like people who refuse to fill the survey, time, and if there is any questions coming from youth. So the survey has been conducted after the written authorization of Ministry of Education, and we avoid period time close to vacation or to the exam. The survey take only 5 days, and our data has been analyzed using SPSS version 20. So the total samples was 5,801 students. 63% of our students has 15 to 17 years old. Females are almost 60%. And concerning the prevalences of drug use, we found that our youth are more using tobacco than alcohol, hashish, which is cannabis, sedative, which are benzodiazepine without medical prescription, cocaine, crack, and heroin were not very used. And we see that there is a difference between lifetime, last 12 months, and last 30 days prevalences, which show that our youth are experimenting drugs. When we try to have an idea about the prevalences according to gender, we see here, and it's for all drugs, that males are using drug more than females, and they are experimenting drugs because there is a big difference between lifetime prevalence and current prevalence, which is the use during the 30 last days. It was similar for tobacco, alcohol, hashish, but not for benzodiazepine. For example, for benzodiazepine without medical prescription, we found that male and female prevalences are close, and there is no significant differences. We found also another interesting finding. It is that females don't use the same drugs than male. It looks like male are more likely to use tobacco. After that, they use alcohol, cannabis, and benzodiazepine. For female, they use mostly tobacco, then alcohol, and the third drug of choice was benzodiazepine, then hashish. And it could have cultural explanation because maybe female are more likely to use the most available drugs than male. Concerning the quantity, we found that youth are using experimenting drugs, but we have a proportion of almost 25% of youth who are using drugs many times during the last month, and this proportion is maybe already concerned by a pathological use of drugs. Concerning the age at onset, we see that they are using drug younger. We conducted a survey in 1995, and we found that the age at first use is 18 years old. Now it became younger. And when we tried to assess the age at onset for different ages, we found that, for example, 15 years old are now using drug younger than 16 or than 17 years old. The perception of the risks of the drug use risk show that there is between 25 to 30% of our youth don't perceive that using drug it's highly risky. So they say that maybe they are not risk, or maybe there are a few risks of consuming drugs. We tried to find some predictive variable that could be linked to drug use, and what we found, according to the survey, we found that people who are using drug are more likely to have family problems, don't have a good relation with parents, or they are more likely to spend night at home without family authorization. They are also more likely to have many absences from schools, to have a below average of grade, and to say that drugs are highly available. These kids who are using drugs are more likely also to don't know that using drug is risky for health, for health. And they don't know that the Moroccan legislation is against drug use. So even MedSpad, the survey has a lot of opportunities because it gives us an idea about what is going on among our youth. And we have funding provided, and we conduct now 3 surveys. There is some challenges because it took time to have the Ministry of Education authorization. And each time we want to conduct the survey, we have to convince the Ministry of Education about the importance of conducting this drug, as the ministry is all time changing, so we have to do this effort every time. And still now we have difficulties in publishing the data because we need the Ministry of Education authorization. And we don't use this data for evidence-based prevention program, but we are trying to work the Ministry of Education and to let them know that it's important to have an evidence-based prevention program, a Moroccan model, because there is a lot of NGO conducting prevention at schools, but we don't know what they are doing. They are working in different way, and they don't have any model, and they don't evaluate their work. So it's important to work on a Moroccan model and to use it by NGOs or by all people who are concerned about prevention at schools. So this is the team who were working for MedSpad. And thank you for your attention.